Hi, Don Williams for Institute of Sports and Spines. Today we're talking to Luke Attkins, Remedial Massage Therapist at Institute of Sports and Spines, about some topics that he gets asked regularly about in regards to massage. So Luke, how are you today?
I'm good. Yourself, Don?
Yeah, good, thanks. Luke, people apparently ask all the time, what are the benefits of massage? Why do people go and get a massage?
So some benefits of massage can be pretty much just from reducing stress. So everyone has a stressful day every now and again, so reducing stress can be very beneficial by getting a massage. Other ones are increasing mobility and flexibility, along with getting lymphatic system. So if you've got a cold, getting a lymphatic drainage massage is always good, part of remedial massage. And coming in and just getting some circulation, increase in circulation through the massage itself.
So Luke, what is a trigger point?
So a trigger point can be classed as just a tight muscle, really painful to touch in areas. Can also have an effect on decreasing motion. So if you've got a tight trigger point through a certain area, you can always find that it's really tight and restricted going into that motion.
And massage is a good way to relieve trigger points.
It is. So we do, through remedial massage, we do trigger point therapy. So what trigger point therapy is just putting pressure over that specific point, finding the one that is the most painful, holding it for a certain amount of time, and then having it release.
So Luke, what actually got you into healthcare? How did you get to this point?
Thanks for asking, Don. So I had major injury, fell 15 metres out of a tree into a pile of wood, onto my head, which kind of explains a lot of things that happen in my life. So had that happen for dealing with it for 10 years. Ended up seeing a chiro when I was 11 when it first happened, got treated, symptoms went away. Came back a lot worse when I was 20. Ended up having multiple surgeries and then getting flown over to America to see a chiro who was actually my uncle. Got treated over there for 3 months, and then from there flew back and started my uni degree from there. I've currently finished my Bachelor's of Science in Chiropractic, and I have almost finished my Master's in Clinical Practice. Along the time, I went through and did my remedial massage course. So I started to integrate massage therapy and soft tissue work into my chiro for uni. And from there, I got a job here at the Institute of Sports and Spines using remedial massage and learning about rehabilitation.
So Luke, there's been a lot of talk recently about fascia and fascia work. Can you tell us a little bit about fascia?
Yeah, so fascia is just a connective tissue that covers over the muscle, helps it slide between the skin and the muscle itself. And when you get a muscle injury, a lot of the times it's fascial related. So you get a pulling pain or a tightness that is only there when you move a certain way. So treating this fascia is usually done by using a scraping tool. So this is known as an assisted scraping technique, and as well as fascial manipulation, which is just grabbing the skin and lifting it or rolling it over the area of pain.
So Luke, you've been doing your Masters now for a couple of years, which is about the same time frame you've been working at Institute of Sports and Spines. A lot of people are asking you, are you going to be staying on here when you finish uni? How would you answer that?
That's a very good question, Don. To be honest, I would love to stay here and work at the Institute of Sports and Spines as a chiro. It would help me evolve in learning more about rehabilitation and helping me gain more knowledge in that aspect as well as increasing my ability as a practitioner to evolve and become a lot better at what I love to do.
So there's some discussions about potentially opening the clinic up on weekends as well next year, and that's something we've been talking about, is the potential of offering services on Saturdays, and that's something you think is a benefit to patients. Why do you say that particularly?
Yes, definitely. Opening up a clinic on Saturdays is really beneficial actually, as you give a lot more people the opportunity to come and get a treatment, or offer the people that can't make it in on the weekdays an opportunity to come and see a chiropractor on the weekend.
It's a good idea.